This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your body is a busy factory, and your lungs are the delivery workers responsible for bringing in oxygen and throwing out the trash, carbon dioxide. When a person has trouble breathing, paramedics look closely to see if the workers are just having a really tough, stressful day, or if the factory is actually shutting down. Here is how to tell the difference between the two. 1. Respiratory distress, the hard workers. Respiratory distress means the body is working extra hard to breathe, but it is still getting the job done. The lungs are struggling, but they haven't given up yet. What it feels like, imagine running up a massive hill while trying to blow up a giant balloon. You are huffing and puffing, your heart is racing, and you feel tired, but you are still moving. How a paramedic spots it. The tripod, the person might lean forward with their hands on their knees to help open up their chest. Skin signs, they are sweating because breathing has become a massive workout, but their skin color is still normal. Talking, they can still speak, though they might have to stop for a breath every few words. We call this short phrase speech. Extra muscles, you might see the muscles in their neck or between their ribs pulling tight every time they breathe in. 2. Respiratory failure, the factory shuts down. Respiratory failure is much more serious. This means the body's workers are completely exhausted, and they can no longer get enough oxygen in or get the trash out. The factory is starting to fail. What it feels like, imagine you kept running up that hill until your legs totally turned to jelly, everything went blurry, and you just couldn't take another step. How a paramedic spots it. Sleepiness or confusion. Because the brain isn't getting enough oxygen, the person will act very sleepy, confused, or might even pass out. Changing color, their lips, tongue, or fingertips might start turning blue or gray. This is a big warning sign that the oxygen is running out. Slowing down, instead of breathing fast and hard, their breathing might suddenly become very slow, shallow, or quiet. They are simply too tired to fight anymore. How paramedics differentiate in the field. Paramedics use their eyes, their ears, and some cool medical tools to figure out exactly which stage a patient is in. What the paramedic checks: mental status, speech, work of breathing, skin signs, and pulse oximetry. In respiratory distress, struggling, assessment finds patient awake, anxious, alert, speaking in short, broken sentences with fast, heavy, loud breaths using accessory muscles. They are pale and diaphoretic, and their SpO2 may be within normal limits or slightly decreased. In respiratory failure, failing, assessment finds patient sleepy, confused, unresponsive. They cannot speak at all. Breathing effort is very slow, shallow, or barely moving. They have blue, gray, or purple lips and skin, and SpO2 is dangerously low. The big takeaway: in distress, the body is fighting hard and fighting fast. In failure, the body is running out of gas and giving up. Paramedics have to act quickly because if someone is in distress for too long, they will get too tired and slide into failure.